Dr. Nowill, how are you?
Very well, thank you.
I want to wish you a very happy Global Wellness Day. And I'm very excited to introduce Dr. Nowill to the Global Wellness Day community. Dr. Nowill is an immunologist in São Paulo, Brazil. And I had the opportunity and the privilege to be treated and to work with Dr. Nowill over the winter in São Paulo, Brazil. And the reason why I'm particularly excited to be interviewing you today, Dr. Nowill, is because you have been working for quite a while, actually, on a treatment that could be effective for people who already have contracted COVID-19. And we know that, for example, in Brazil or in many other places around the world, such as India, for example, and other places, unfortunately, the vaccine strategy is not, fully implemented. And we know that hospitals are being overrun and they're going through a very tragic situation. And your treatment is designed, again, it's not a vaccine in the sense that it doesn't compete with the current vaccine on the market, but it's a treatment that is geared towards people who have already contracted COVID-19. So I'd love for you to tell us a little bit more about yourself and your background, and then we'll go into the gist of what the treatment is all about.
Okay, I am primarily a physician, but also a scientist who is interested in the field of immunology. As a medical doctor, I have always been fascinated by any attempt to translate basic science concepts into new practical therapeutic interventions for serious unsolved conditions like sepsis, severe infection, and cancer. In fact, immunotherapy, that is a recent successful approach, has bridged both worlds for me.
So how do you think, Dr. Nowill, that your previous experience with bacterial sepsis could help in treating COVID-19?
To make a long story short, I have studied sepsis in general and the cytokine storm that triggered this condition for quite some time. And as consequence, we have developed a therapeutic vaccine for bacterial sepsis, who had shown very encouraging results. However, this research was preclinical. In other words, it was performed in laboratory animals. And as you know, COVID-19 is a serious disease that is associated to a cytokine storm, and virtually all patients who die have sepsis. Thus, it was natural for us to propose last year the use of our therapeutic vaccine in COVID-19 patients. Besides the experimental data, on a compassionate basis, I did treat few patients with bacterial sepsis and severe infection in the past, and the results were great. As we have previously observed in laboratory animals, sepsis could be reversed in this small cohort of compassionated treated patients with bacterial sepsis and severe infection. However, we need to stress there is just an anecdotal case, which at best gave us hope that our approach might work for COVID-19 as well. Really, it is our expectation that our therapeutic vaccine will abort the cytokine storm, which is the cause of sepsis and all the secondary complications that follow, such as systemic infection, secondary sepsis, or the acute respiratory distress syndrome, and the major lung, heart, and kidney dysfunction. Avoid the eventual multi-organ failure. However, the only way to test this possibility is to conduct a prospective randomized clinical trial of our therapeutic vaccine in patients with severe forms of COVID-19. And we are preparing ourselves to do just that.
So if I summarize what you just said, Dr. Nowill, this treatment that you have administered at your clinic on a compassionate basis to a high number of patients that have come and see you over the past year was instrumental in reducing the cytokine storm, which is really what is affecting patients that end up going into the ICU and potentially losing their life. So if you could tell us in a few words, what is the treatment exactly? What can people expect when they get to your clinic and get your treatment?
I utilize it in a compassionated form in hospital. The treatment consists of the therapeutic vaccination with multiple antigens derived from selected pathogens against which most human beings have preformed immunity because of natural infection or because of previous vaccination. Practically, we overlap the new pathogen, in the case SARS-CoV-2, with a pool of unrelated antigens that compose the pool of therapeutic vaccine. This means that the immune system now will see the new pathogen alongside multiple other pathogens, for which it already knows what to do. The recall of the memory immune response to unrelated pathogen is completely dominant and capable of turning the deleterious hyperinflammatory reaction that produces the cytokine storm into a very controlled and effective hypoinflammatory immune response against the new pathogen, named the SARS-CoV-2, dampen the cytokine storm. To make it simple and easy for you to understand, you can imagine that the therapeutic vaccine instructs the immune system to see the new animal as an old foe, for whom it has a ready-made response. In other words, you replace the virus by the vaccine on the control of the immune response, reversing the severity and inducing the correct immune response. That is the real purpose and what is to be happened.
So you've created yourself some sort of a vaccine as well. People who'd come to your clinic or in the hospital would receive a number of injections. These injections contain pathogens which stimulate the immune system so that when people get the COVID-19 virus, they're ready for it and they don't provoke a cytokine storm. Is that a good summary?
Yeah, the good summary is the therapeutic vaccine overlap the image that by which the immune system see the pathogen. They will see.
You can recognize the pathogen.
Choose your antigens. You change everything.
Yeah. So very quickly, we have 1 minute left. Can you tell us in a few words now if you're ready to run a clinical trial? Because you and I discussed it when I was in Brazil, and recently I know you were working on that. Can you tell us more about the clinical trial?
The clinical trial, we are ready to do it. But unfortunately, we still need to secure sponsorship to get our trial going. Once you get it, we can complete it relatively fast. The Global Wellness Day with this interview give us hope and optimism, but also a very important question. Can we join force to turn new projects like ours into reality? Can we? That's the question.
I see. Well, Dr. Nowill, I think you're working on a very important project, and this is why I wanted you to participate today in Global Wellness Day. This is something that's going to be crucial for humanity, and especially for countries which don't have a strong, vaccine strategy, and we don't know how many months or years that's gonna go. So I really want to thank you for your participation. Wish everybody again a great Global Wellness Day, and we'll speak next year.
Okay.
Thank you, Dr. Nowill.
Thank you.
Thank you very much.